Canadians spend as much on veterinary services and medications for their pets as they do on over-the-counter and prescription drugs combined, out-of-pocket spending, that is. And these spending patterns, which are from Statistics Canada data, are consistent with surveys showing that most Canadians think of their pets as real, genuine family members. 1 out of every 2 Canadian households include a pet. Dogs reside in 1 out of every 3 of these households. The ratio of people to dogs registered with the City of Calgary is 10-1. The Calgary Humane Society advises the public that, on average, basic care for a dog will cost about $1,000 a year. The Calgary Food Bank asks every client whether a pet is present in the home, because many people will feed their pets before themselves. I'm aware of these facts and figures because for the past few years, I've been involved leading a research program on connections between pets and public health. When we interviewed people, mainly in Calgary, who were treating a dog or cat for diabetes, people told stories indicating that they blurred the lines between their pet's health and their own health. For example, one woman recalled that her cat was diagnosed with diabetes shortly after her father died of cancer and after a close friend died in a house fire. She wondered whether her stress levels triggered diabetes in her cat. Similar to animal models in laboratory research, pets provide people with a way of understanding disease, causation, potential remedies. Pets are important, more than we realize, for health literacy and for how members of the public engage with science. Building on this research, a veterinarian philosopher who is a postdoctoral fellow in the group took the lead in adopting another example from this research on diabetic pet care, and he adapted it as a teaching case for veterinary students. The case ran for 6 hours and featured over 3 different days, featured a man with type 2 diabetes, his wife who had arthritis, and a diabetic dog, all of whom were living in a low-income neighborhood. Professional actors played the client roles, and it involved, for example, learning to administer insulin, and eventually, at the end of this case, a discussion around euthanasia. We introduced the students and the veterinarian coaches to evidence on the social determinants of health in a way that was gripping and practical. The next step in this research program was to look at move the focus from indoors to outdoors. Calgarians with dogs, we found, are 3 times more likely to walk for recreation in their immediate neighborhoods, in the summer as well as in the winter. And that difference in activity is enough to prevent cases of osteoporosis, osteoarthritis, some cancers, type 2 diabetes, depression, even Alzheimer's. Now, isn't all that obvious? And I would say no. This program of work is fundamental. First of all, it's rooted in actual everyday life, the context of the everyday. And second, it's an example of what an anthropologist and social worker embedded in public health can bring. The lead author of the paper showing dog owners tend to be more active year-round is a master's student as well as a third-year medical student in the Leaders of Medicine program. We partnered with the Calgary Humane Society to bring this research to public attention, and the lead author, Prab Lail, was featured as a public health spokesperson. She had the opportunity as part of her training program to be involved in reaching out to the public and communicating about public health and about health science. I have one take-home message today. Health is all about relationships in context. Thank you.